Well, hello everyone, and welcome to our second FIP-UNITWIN Global Summit on Pharmaceutical Education and the launch of the FIP Education Transformation Toolkit. I'm Ralph Altieri. I'm chairperson of FIP Education and the dean at the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences in the United States, and I have the pleasure of co-chairing today's program. And joining me as our other co-chair is Lillian Azzopardi from Malta. Welcome, Lillian.
Thank you, Ralph, and good morning, good afternoon, and good evening to everyone.
So today we have myself and Lillian, along with other speakers and panelists, as you could see on this slide. We have our president, Dominique Jourdain. We have our FIP CEO, Catherine Duggan, joining us today. Our panelists are Toyin Tofada from the United States, Rajani Shakya from Nepal, Mohammed Rahal from Lebanon, Paul Gallagher from Singapore, Silvana Nair Laite from Brazil, Aranola Jota from Nigeria, and we have our two superb FIP staff members supporting us, Nilhan Usman and Alison Ubang Itukakpan. So welcome everyone, and thank you for joining us today. So a few announcements to make before we get started with the program. As you could see here, the webinar is being recorded and live streamed via Facebook. The recording will be available on our website, fip.org. Please use the question box for asking any questions you may have during the program. You're also welcome to provide feedback to us at webinars@fip.org. This is very helpful for us as we plan future programs. And most importantly of all, join us and become a member of FIP at fip.org membership registration. Okay. So today's program has a number of objectives. Building on the first Global UNITWIN Summit of 1 year ago is to present progress since that time on the priority FIP development goals for each of the regions of the 6 WHO regions of the world in the context of pharmaceutical education, present progress on the FIP-UNITWIN regional roadmaps 2021, and the impact on FIP global call to action on pharmaceutical education, discuss the way forward for the delivery of each region's roadmaps with establishment of regional FIP-UNITWIN Centers for Excellence program that will establish in each of the 6 regions in the months ahead. And importantly, launching of the FIP Educational Transformation Toolkit, which is designed to help each of the regions further develop their educational programs. Okay, so today's program, we've been through the welcome already by myself and Lillian. We'll have remarks from our leadership of FIP, our president and CEO. Then we'll have a review of the so in 2022, following on the 21 workshops, we paired different regions together. So intra-regional workshop were held. And we'll review what the outcomes were of those different paired regional workshops to give everyone the background on what brought us to today. And then we'll move over to the panel discussion, which is a very important part of today's program. And this is where you can insert your questions into the Q&A box. Then we'll have the launch of the Education Transformation Toolkit, as I mentioned, a few announcements by Nilhan, and then we'll have a fun little engagement activity near the end, and then Lillian and I will close out the program for the day. So a little bit of background about UNITWIN. So UNITWIN stands for University Twinning, which means we are learning together and share our knowledge and programs with each other. If we refer to the circle above here, you see at the top, we're starting with networking and partnerships. So this is a very important part of UNITWIN and also for advancing our programs. And that leads to the sharing of good practices and transfer of knowledge amongst the various schools that are participating. That in turn leads to education development and transformation to meet local, regional, and global needs. So accordingly, the Global UNITWIN program serves as a platform to promote an integrated system of research, training, information, documentation activities in the field of global pharmacy education to address issues of academic capacity, quality assurance of educational programs, and workforce competency. Also to establish a dynamic and accessible database of faculties, educational data and resources for sharing within and outside the network, facilitating north-south, south-south, and intra-regional cooperation. Establish a forum for discussion and debate on trends and developments in pharmacy education, facilitated by the network partners, including non-governmental organizations and professional agencies and associations. To provide a mechanism for exchange of ideas, skills, resources, and good practice, including staff exchange for skills and capacity building outcomes. And to foster international collaborative research, policy synthesis, and strategic development, with a particular focus on international development issues and sustainable practitioner development policies. So a little bit about the FIP-UNITWIN regional workshops in October of 2021. At the FIP-UNITWIN regional workshops, 1 FIP roadmaps for each region were designed to advance pharmacy and pharmaceutical sciences education. In order to make progress on the roadmaps and the global call to action on pharmaceutical education, follow-up FIP-UNITWIN regional workshops were held in November of this year. And this was facilitated by inter-regional exchanges based on priority FIP development goals and common regional roadmap elements by pairing regions based on their common priority goals. During today's event, we'll present to you the outcomes from these inter-regional collaborations. Next slide, please. So at this point, I will turn over the program to my co-chair, Lillian, as a party. Lillian?
Thank you, Ralph, for providing an introduction to and a start to our workshop. And as has been already identified by Ralph, we are here today in this session to also build on work that was carried out over the past 2 years. So here I would like to acknowledge and thank all the regional workshop chairs who were participating in the UNITWIN workshops for 2021 and 2022, coming from the different regions of the world, and also the FIP officers who were supporting the team in providing and gathering the discussions and your feedback during these workshops. So thank you all for the feedback and the contributions. And now I would like to move on to the second part of this workshop, which is the leadership remarks. And here I'd like to invite the president of FIP, Dominique Jourdan, and thank you for joining us. And it's a pleasure to pass on the floor.
Thank you very much, Lilian. Dear colleagues, it is my privilege to welcome you to the FIP-UNITWIN Global Summit on Pharmaceutical Education, where we will consolidate the findings from FIP-UNITWIN regional workshops held in 2022 and progress the FIP Global Call to Action for advancing pharmaceutical education with the launch of the FIP Education Transformation Toolkit. The United Nations has set 2030 as the deadline to achieve the UN Sustainable Development Goals. FIP has pledged to support the achievement of these through our own FIP Development Goals. The FIP Development Goals bring science, practice, and workforce and education into one transformative framework for our members and the wider profession. It is in FIP's mission to enable educational and scientific transformations to advance our profession. We need to partner with you in this transformational journey, as well as with stakeholders such as UNESCO, the United Nations Educational, Scientific, and Cultural Organization. The FIP UNESCO partnership positions UNITWIN Regional Centers for Excellence as a fundamental platform to enable educational and scientific partnerships by bringing together FIP's academic institution members, regional forums, professional organizations, and educational stakeholders. At the end of November, we submitted our FIP UNESCO Agreement renewal package to UNESCO, which will successfully lead to the rolling out of UNITWIN centers across all regions except the African region, which had the Pioneer Center for Excellence, now transitioning to the African-wide schools of pharmacy. In 2023 and beyond, these FIP UNITWIN Centers for Excellence will be platforms to advance pharmaceutical practice through education and establishing educational partnerships. Next year, FIP will hold a Health Minister Summit where we will report progress towards the achievement of the FIP Development Goals. Our one FIP educational policies, including the FIP UNITWIN regional roadmaps for pharmaceutical education and the FIP Global Call to Action on advancing pharmaceutical education, will guide us towards this Health Minister Summit and onwards to 2030 to implement all FIP development goals in the context of pharmaceutical education with trust, in solidarity, and by acting on addressing needs and priorities specific to your region. We rely on you to engage and collaborate with FIP on this educational transformation journey. And we are committed to support your region by establishing FIP UNESCO UNITWIN Centers for Excellence within all regions. I wish you all a successful global summit, and I look forward to establishing partnerships with our members that will advance and transform pharmaceutical education. Long live pharmaceutical education. Long live FIP.
Thank you, President Dominique Jourdan, for spearheading this vision of global networking for educational transformation. Thank you.
It was my pleasure.
And now it's a great pleasure to pass on the floor to Dr. Catherine Duggan, the CEO of FIP. So on to you, Dr. Duggan.
Thank you so much, Lillian. What an honor to be here with you today and with all our colleagues, both in the panels and joining us online. Hello, everybody. As I mentioned, it's a great honour to be here today and to welcome you to the FIP-UNITWIN Global Summit and to build on the introductory remarks from President Dominique Jourdain as we celebrate the launch of the FIP Education Transformation Toolkit. I would like to start by thanking you, our FIP members, our academic institutional leaders and key pharmacy stakeholders for taking the time to be with us today, as ever. As always, a special thanks to our FIP chairs, the officers and the FIP team for their commitment and hard work in preparing such an important programme today. After meeting together face-to-face in September in Seville, we're truly delighted that this year's regional workshop held in November built on the momentum of our first face-to-face meeting for 3 years. The meeting drew together successes of the 2021 regional workshops where FIP-UNITWIN regional roadmaps were developed and the FIP Global Call to Action for Advancing Pharmaceutical Education. Using these educational policy interventions, we have forged alliances and partnerships to create platforms for collaborations to increase access to educational expertise and experiences. Really, we're pulling it all together. Launching the FIP Education Transformation Toolkit today is our further commitment towards progressing the global call to action for advancing pharmaceutical education, which calls on all of you, academic institutions, professional organisations, policymakers, key pharmaceutical stakeholders around the world to implement the 18 action items for advancing pharmaceutical education, nationally, regionally and globally. The FIP UNESCO UNITWIN programme will implement FIP development goals across regions through partnerships using FIP as a global platform, while the FIP provision programme will facilitate educational transformations within the countries where there are major inequities or gaps in frontline practice. Together and through inter-regional collaborations, we will build clear strategies for transforming pharmaceutical workforce development, continued education and training, career progression opportunities, pharmaceutical education delivery, research infrastructure, development and manufacturing capabilities, as well as evidence-based regulatory oversight. Without planning for the workforce of the future, in terms of the numbers that we need across our nations, the skill sets we need, the capacity, the capability, we won't be able to deliver our potential, and the universal health coverage agenda will not succeed. In solidarity with our President, Dominique Jourdain, I want to repeat, FIP is beside you, committed to providing the global platform for you through this FIP-UNITWIN programme. We're here to support you, we're here to guide you, and we're here to share with you. We aim to offer FIP academic institution members the opportunity to become members of the next FIP UNESCO UNITWIN regional network, to forge alliances and partnerships on platforms of collaboration, to increase access to your educational expertise and experiences. And this will all feed in once our agreement with UNESCO is renewed. We're super excited to be here to provide this platform for you, our members, and for our profession, and together to advance pharmaceutical education globally. I'm super excited to be part of this event, and I know you will be too. Thanks a million.
Thank you, Catherine, for your reflections on the FIP UNESCO collaboration and how this is going to contribute to workforce planning and support towards pharmaceutical education. So thank you again. And now we will be moving to the next part of the workshop, where myself and my co-chair Ralph Altieri, we will be sharing with you the main points, the highlights from the regional workshops that were carried out in November this year. And I will start with putting in the highlights from the European and Eastern Mediterranean regions. And we can see in the next slides the procedure and the approach that was undertaken for this year's workshops, where through the work that was carried out in 2021 with the FIP, we could identify the common priority FIP development goals for the different regions. And based on this commonality, inter-regional discussions were created, and we had three groups whereby the Americas and Western Pacific were focusing on the FIP development goal dedicated to academic capacity. The European and Eastern Mediterranean had the commonality of competency development as the FIP development goal, and the Africa and Southeast Asia also focused on academic capacity as the FIP development goal. And through the next slide, we can see that during these workshops, where many of you were contributing to, we were engaging the two regions to reflect on what would success look like when we implement this roadmap in the different regions, and how do we achieve this roadmap action. And today, it gives us great pleasure to be able to present the global perspective by touching on the highlights from all the interregional workshops. And myself and Ralph, and together then with the panelists, will be reflecting on these outcomes, which are going to be the high-level findings from these workshops. The detailed results will be published in a manuscript in 2023, and will also be the starting position for the FIP-UNITWIN Centers for Excellence that are going to be developed across all the regions. So let me move on to our first region, which is Europe. Actually, it's the region where, together with colleagues from Europe, I was also involved, and we had a brainstorming session. And during the workshop, for our first question, which we can see here, what is the success that the European region is looking at in terms of competency development, we can see that the main scope, the main area is the alignment of pharmaceutical sciences and pharmacy practice in the educational part and the competency development, the recognition that there has been an expansion of the scope of practice. And because of that expansion of the scope of practice, the having a set of entrustable professional activities, EPAs, that reflect that scope of practice, together with the development of specialist mechanisms and frameworks. The expectation of how we can get there, which we can see in the next slide, is that the regional participants actually highlighted that engagement, stakeholder engagement, and multi-sectoral, inter-region and intra-regional discussion is important, so that we move towards mapping how the evolving scope of practice compares to existing competency frameworks, and very importantly, to share the experiences in the region through case studies that can be used as examples of how competency development is being evolved in terms of the evolving and expanding scope of practice. Moving on to the next region, which was the Eastern Mediterranean, that had the commonality of a focus also on competency development. During this interregional workshop, participants also reflected on the same questions, and we can see a lot of reflection to the points that I have already referred to earlier for the European region. The success for the Eastern Mediterranean region looks at harmonization through the region, through a common competency framework. Again, a mapping exercise to compare the educational outcomes with the competency standards, and a reflection of the need in the region to ensure and to mobilize adequate recognition of the pharmacy profession by society and the healthcare providers. And during the workshop, the second question of how do we get there was actually, we can see again an emphasis on the importance to map. So the mapping exercise has also been identified in the Eastern Mediterranean region as a powerful tool towards competency development. The strategic engagement of stakeholders, including ministries, Ministry of Health, Education and accreditation bodies, and to set achievable key performance indicators for the roadmap that is established by FIP, so that member organizations and educational institutions in the Eastern Mediterranean region can use to help and support the achievement of this roadmap. And with that, a very brief overview of the two regions, I'll now hand on to my co-chair, Ralph Altier, to walk us through the highlights of the other regions.
Well, thank you, Lillian, for going through those other regions. And now I'll turn to the other ones, which we'll start with, if I have the next slide, the Americas region. So a major theme across the Americas, Western Pacific, Africa, and Southeast Asia regions is academic capacity. And the various ways they will each address this one issue, realizing that academic capacity really has two major components to it. That is the quantity or the numbers of faculty that you have to deliver a transformed pharmaceutical education program, as well as the areas of expertise of the faculty to meet the defined educational needs of each region. So for the Americas region, this was subdivided into North America region, and then Central and South America. We'll go through each of them in that order. So here again, the roadmap action for North America related to academic capacity is to create awareness of the job opportunities and the need for young pharmacists and pharmaceutical sciences to become academics. So what does success look like? It's an attractive academic workforce, having graduates who want to pursue an academic career, and region-wide awareness of the job opportunities that exist in academia, from the science side to the practice side and other areas that are important, such as outcomes research and things of that nature. So how do we get there? In the North America side is committing human and financial resources to this effort, introducing graduate students, when they are students, to what the academic roles are, and hopefully encouraging them to take up academic positions, increasing the social media presence of academics, and compiling success stories of colleagues in academia. And this is always an important part of trying to influence people in certain career opportunities, because there's nothing like seeing this success stories that are out there. In Central and South America, the roadmap for, again, academic capacity was to collaborate to establish quality standards for interprofessional and multidisciplinary education, experiential learning, cognition, metacognition strategies, and hybrid teaching methods. So you see they're taking a different approach. And this is how you can have interregional collaboration that will help all participants throughout the Americas region. So what does success look like? Building more alliances between the academic institutions and the other stakeholders that are involved, better standard and quality of pharmacy education within countries and also across the region, and a strong regulation system for pharmaceutical education throughout the region. That's both North and South America, of course. Now, how do we get there? Performing a situation analysis on both the two major themes of interprofessional education and multidisciplinary education, mapping relevant stakeholders and bringing them into this process so they can inform pharmaceutical education and develop a way forward for transforming pharmaceutical education to meet the needs of the region. and identify relevant resources for development of technical documents such as successful teaching tools that will help the various schools and countries in the region meet this development goal of academic capacity. In the African region, now this is where the UNITWIN program was initiated, and they've taken another approach to academic capacity. One result of what was then the Center for Excellence in Africa is the intent to develop an African Association of Pharmacy Schools to fill a gap in Africa that mirrors the similar associations that are found in other regions of the world. So their roadmap action was to develop this African Association of Pharmacy Schools through a task force with members from around Africa to set up, operate the association and deliver their priorities, their various priority FIP development goals, one of which is, of course, academic capacity. So what does success look like in the Africa region? Harmonized quality and standardization of pharmaceutical education across the region, improved academic capacity for faculty through collaborative research, and assuring that all of the countries in the region are represented in this African-wide association of pharmacy schools. How do we get there? Creation of a sustainable association to foster networking, collaborations, sharing success of developing faculty needed to meet the pharmacy education needs throughout Africa. Leveraging the existing networks that support the programs and the platform. Effective advocacy, this is always a very important mechanism that's needed, and mobilization across the region. And this is advocacy within the pharmacy education realm, but also with other stakeholders, again, as Lillian mentioned, ministries of health, practice associations, and so forth. And a clear action plan for implementation of its strategic priorities. And I can report to you that as a FIP Ed chair, I participate in the meetings of that workforce, and they're making really excellent progress in their goal to form this association. The next region is the Southeast Africa region. And here, the roadmap is to support the region in setting up, running their upcoming FIP-UNITWIN Center for Excellence and implementing their priority FIP development goals, again, of which academic capacity is one. So in the Africa region where UNITWIN began, we set up a Center for Excellence in Africa that led the development of educational programs, as well as this concept of the African Association. So here is the idea of setting up the next Center for Excellence in the Southeast Asia region that will then be rolled out across the rest of the regions around the world. So what does success look like for their roadmap? Harmonized curricula addressing the needs of the region, increased number of research projects and publications coming out from the faculties, collaboration between and among the faculty of the various schools. Again, this fits into the entire UNITWIN concept of networking and sharing experiences, and holding staff exchanges between institutions of varying academic educational capacity and learning from each other and bringing that back to your home institution to help advance pharmacy education. How do you get there? Early engagement of all relevant stakeholders with clear action plan and signed commitments. Clear leadership of the center from FIP with support and ownership by the academic institutions of the Southeast Asia region, and to ensure the appropriate faculty expertise represented within this Center for Excellence. So, of course, we in FIP-UNITWIN are very happy to help support the development of their Center for Excellence and advancing pharmacy education in their region. The last region is the Western Pacific region, again focused on academic capacity. And here the Western Pacific region demonstrates, if I may have the next slide, please, a different approach to academic capacity through faculty and student exchanges across the region. And I think you can see by looking at these various regions and their different approaches, how intra-regional, and interregional exchange of ideas is going to enrich the process of developing and advancing pharmacy education globally. So here, Western Pacific wants to conduct intra-regional faculty and student exchanges, collate case studies of successful exchanges, and secure seed funding to support these research initiatives. So what does success look like? Engagement of schools from all the countries in the region as either hosting sites for these exchanges or being the recipients of the exchange programs. This is very similar to a program that exists in FIP called Pharma Bridge, and having been a participant in that, it's a really enriching experience. And then, of course, providing evidence of successful exchanges as best practices development. How do you get there? Engage regulatory and political organizations in addition to educators in this process. Providing seed funding to be successful. These exchanges need to be ongoing, and you need recurrent funding to keep this process going, and keeping the exchanges, monitoring that the exchanges have been accomplished, and of course that outcomes are being achieved. So that gives us a review of all of the programs that develop these roadmaps in 2021, and that we are building on through these paired regional workshops. And that gives us the background that we need for moving on to our panel discussion. So I'll now turn this back over to Lillian, who will moderate the upcoming panel discussion.
Thank you, Ralph. And now we come to the exciting part for the workshop today. And joining me, I'd like now to invite the 6 colleagues to remotely open up the cameras and join me on the floor. I'd like to introduce Toyin Tofade from North America, Silvana Lete from representing the Central and South Americas, and Mohamed Rahal, the Eastern Mediterranean region, Rajani Shakya from the Southeast Asian region, Arinola Joda from the African region, and Paul Gallagher representing the Western Pacific region. And we would be moving around this panel to now that we have seen from the very brief highlights what success is expected to look like for these different regions when we implement the priority FIP development goals that have been spotlighted. I'd like to have this very brief panel discussion so that we can touch brains of these colleagues to see, firstly, for the region, what's their reflection on the outcomes for pharmacy practice and sciences across the region. And so maybe we can start going around the world, and we'll start off with Toyin. So on to you, Toyin, for your reflection.
Hello, good morning, good afternoon, good evening, colleagues, and thank you, Lillian. This is a wonderful session. With regards to priority DG1 on academic capacity for North America, which is really to have an attractive academic workforce as what success would look like, I believe that the profession will be better off when our academics are able to balance their workload and life appropriately. And obviously the pandemic didn't help with some of the challenges with workload. So over the years, With increased expectations from quality criteria and accreditation criteria, many academics in colleges and schools have had to add to their duties to maintain excellent standards in teaching, learning, research, and practice. And without clear guidance to incoming faculty academics about what to expect and how to be successful, burnout is inevitable. So we all know that, as I said earlier, the pandemic didn't help, but furthermore, without clear, realistic expectations and workload expectations for academics, it could create a challenge of quality in terms of what is produced for teaching, practice, and research. So one of the ways we're trying to solve that problem, we have identified a task force put in place at the American Association of Colleges of Pharmacy, or AACP, at the Council of Deans. And we've been working, they've been charged to work collaboratively with the Council of Faculties. And the charges for the task force are actually threefold. One, to identify emerging workplace concerns or challenges in the academy, propose potential solutions or remedies. The second one is to assemble different tools used by colleges and schools of pharmacy and other health disciplines to assist with workload, including metrics associated in establishing and assessing equitable faculty workload. And lastly, to discuss the minimal expectations with regards to workload that should be expected and communicated to faculty in the academy, given the different best practice modalities for teaching and instilling knowledge in today's students, junior faculty or junior practitioners, mid-career and advanced. So I'm hopeful that the outcomes of this task force efforts will be very impactful and form a framework for operating as colleges and schools of pharmacy in North America. And I also expect that it will help us streamline activities, expectations, and duties to make the academics role even more attractive and doable. Thank you.
Thank you, Toyin, for that brief but very focused insight into academic capacity development for the North America, and on to, within the same region, on to Silvana for her reflection, please.
Hello, Lilian. Hello, everyone. Good morning from Brazil. The results we found in this roadmap, it's because of some characteristics of our region. So in South and Central Americas, we have grown rapidly in the number of pharmacists trained, and also in jobs and new functions for the profession. We have achieved new positions in the health systems, and it's a great achievement. However, the large inequalities in the quality of pharmacist education and training within and between the countries in our region need to be addressed. And the FIP's initiative, the UNITWIN program, is certainly an important milestone for the quest for harmonization and advance in quality of pharmacy services in our region. So we have grown in numbers. Now we really need to grow in quality as well, and better opportunities for the pharmacists to achieve better positions. So consequently, I can see an important an improvement in the health system's capacity building in our region, with this better training of pharmacists, be better prepared to work in our health systems. What is something really valuable for the Latin American people? Some countries, such as Brazil and Colombia, have developed great advances in their public health systems, and the access to medicines is higher than a decade or 2 decades ago in our region. It's something really related to the pharmacists' work, improving the logistic matters and this service in the pharmaceutical services as well. So the pharmacists have built expertise in interprofessional healthcare in our region, and developing research in this theme and good experiential learning as well. So I think something that will be very important to develop the quality, to enhance the quality of the pharmacy education. So I'm sure the collaborations that are planned to be developed in next years will allow us to achieve a higher position in healthcare teams and better health outcomes in our region. And I'm really excited to develop these projects with you all. So thank you.
Thank you, Silvana, for that reflection, bringing in the interprofessional education and experiential part as an arm towards academic capacity development. And I'd like now to move to the other end, the other part of the globe, and move to the Western Pacific and invite Paul Gallagher, who is who also the region also was reflecting on academic capacity as a priority. So on to you, Paul.
Thank you, Lillian. Hello, everybody. It's a great pleasure to be participating in this event. So what does success look like for the Western Pacific region? And how do we get there? Maybe briefly, 2 points to make. One, the Western Pacific region is a vast geographical region of the world, from Australia, New Zealand, to the French island of New Caledonia, to the massive country that is China, and then to Japan, South Korea, Cambodia, and here in Singapore. And across that disparate set of geographies, there is not one standard of pharmacy practice. There's from very advanced pharmacy practice to poor pharmacy practice. And so success looks like raising the standard of pharmacy practice across the entire region. And also doing that for education. We have the world's #1 ranked pharmacy school in Australia, Monash University. And then we have other schools, faculty pharmacy, that actually are not on a sound funding or sustainable basis. And so if it's about raising the standard of pharmacy practice, it's also, of course, linking workforce with education, raising the standard of education throughout the region. So how do we do that, Lillian, I suppose, is the question. And our region was very pragmatic about resources being key, and it identified, as Ralph pointed out, research being a lever, because having seed funding for research actually drives staff movement across faculties of pharmacy. And also in resources, it's about today utilizing the great resource, the FIP Educational Toolkit that we're going to speak of presently. And it's not also limited to that toolkit with its documents and its digital archives, but actually also using other toolkits, such as the patient safety competence framework that has been developed in Australia, and sharing it across the region. So it's been clever about utilizing resources, such as the FIP Educational Toolkit that I'm going to speak of, and of course, utilizing at the center of it all, the proposed FIP-UNITWIN Center. Thanks, Lillian.
Thank you, Paul. And I'd like to pick here that thank you for also putting in the research dimension in as a possible consideration in academic capacity building that we should be learning from across the different regions. And now I'd like to shift to 2 regions which specifically worked on and focused on competency development, and hence I'd like to call on Mohammed Rahal, who is reflecting on the Eastern Mediterranean. So Mohammed, for your thoughts, please.
Thank you, Lillian. Good afternoon, everyone. Good morning, good evening. I'm glad to be here representing the Eastern Mediterranean region. As you know, our region, one of the strengths of our region is its diversity. Diversity in education and diversity in the practice, in pharmacy practice. And one of the outcomes of the roadmap is harmonization among the region with a common competency framework. And this is very important to have a common background in education and in the competency framework of our graduates. This will need collaboration between educators and regulators, societies, and practice associations locally within each country and within the region in order to advance pharmacy and pharmaceutical sciences. And this goal requires alignment between pharmacy education and science and practice. The education and the science should be able to advance the pharmacy practice and, of course, the advancement and or in the requirements in the pharmacy practice. Also, this requires a creation of quality assurance framework to check the quality of education competencies across the region. So not only to establish the framework, but also we need to evaluate the quality of this framework and the standards in the region. We should also be able to create a well-defined career pathways for the pharmacy practice and the workforce and continuous professional development of the practitioners. Graduates should be competent and skilled pharmacists with foundational knowledge, pharmaceutical knowledge, with patient care oriented, and with lifelong learner capacities. Also, they should be equipped pharmacists, the graduates, with good communication skills, with patients, with the communication with patients and with the public as well, and also develop competent collaborations with other healthcare providers through interprofessional education and interprofessional collaboration in order for optimum healthcare outcomes. A graduate pharmacist should be equipped with effective and proficient leadership skills and innovative and ambitious, and should be flexible to cope with uncertainties and with any emerging threats, such as what we have seen in the last 2 years with the emergence of the pandemic. So the pharmacists should be able to deal and to cope with any emergencies and with any challenges they face.
Thank you, Mohammed, for that reflection and for bringing to the table the aspect of having career pathways and the lifelong learning skills built in the competency development. I'd like to also add the European perspective that also was working in the workshops. We were also working for European region on the competency development. And for Europe, we can see that we have seen over the years now an expanded scope of practice, not only in the patient-facing positions, where we are seeing a number of clinical pharmacy developments with personalization of medicines, but also an expanded scope of practice in the other pharmaceutical settings, particularly in the area of pharmaceutical regulatory sciences and patient safety. And that has been one of the major areas that one was reflecting on in this workshop, and we are hoping that through this toolkit in Europe, we can see that the competency development framework for Europe will look into having commonalities for this diverse pharmaceutical workforce. And in fact, in the European Association of Faculties of Pharmacy, where we try to tie in with the FIP roadmap, we are now looking at having a patient-centered competency development for our pharmaceutical workforce by building on the regional stakeholder meetings with other pharmaceutical associations. So now we'll move again across the globe onto Southeast Asia and I'd like to pass on the floor to Rajani, who will give us her reflection where the specific focus was again academic capacity. On to you, Rajani, please.
Thank you, Lillian. Hello, dear colleagues. It's a pleasure to be here and put my few words. The prioritized development goal is the development goal 1, that is academic capacity development for this reason. Pharmacy practice, as we know, in most part of the Southeast Asia region is still struggling for development and recognition. There's lack of people's awareness, lack of acceptance, lack of skilled and experienced faculties, and also government policies is not facilitating. These are some of the challenges in this region. There is a deficiency not only of practicing pharmacists, but also of an ideal pharmacy practice setup in healthcare system. We understand that for the provision of pharmacy services anywhere, there are mainly two important workforce needs. Firstly, an appropriately trained pharmacy workforce to provide services, and next, a competent and committed academic workforce to train a new pharmacist and other pharmacy support personnel. Improvement of quality education and training are the key elements for the sustainable development of pharmaceutical workforce for pharmacy practice. Academic capacity enhancement is very essential to provide a competent pharmaceutical workforce. Undeniably, the abilities, skills, and expertise of educators in pharmacy schools contribute to the building of academic capacity of the pharmacy workforce. And for academic capacity development, capacity building of faculty member is equally important. Only a proficient and motivated faculty member will be able to prepare pharmacy cadres who are competent enough to meet the demand of quality patient care service. I'm very glad that Southeast Asia region has been selected for the next UNESCO UNITWIN Center of Excellence. I'm hoping that it will be supporting the development of pharmacy practice and sciences in this region by enhancing academic capacity through intra-regional academic partnership and exchanges, peer-to-peer knowledge exchange, resources, experience exchange, increased number of projects, publications will support institutions in strengthening the academic capacity of this region. Our aim is to enhance competency-based pharmacy education. FIP's global competency framework modified into regional context is a very good guide to all practicing pharmacists as well as to the schools of pharmacy in development and improvement of their curricula. Center of Excellence will facilitate in identifying competency gap in practicing pharmacists, identify which additional competencies are needed and support the reason for fulfilling this gap. And this Center of Excellence will build an active regional network of School of Pharmacy that will communicate and collaborate for the implementation of needs-based education strategies and establishment of supporting pharmaceutical policies through advocacy to transform pharmacy education. I'm quite positive that FIP's initiative will influence our policymakers on the transformation of education and training for our workforce to improve care and outcomes for patients. Overall, I'm sure that this venture will facilitate this reason in producing high quality professionals for high quality patient care, public health, and scientific advancement. There will be quality enhancement of education and training delivered to our professional workforce that will prepare them very well for current and future roles. And this in turn will uplift pharmacy practice and science in this region. I'm really looking forward to it. Thank you very much.
Thank you, Rajani, for sharing the motivation and the enthusiasm towards the FIP and Southeast Asia collaboration within the UNESCO group. And now on to the African region for Arenola to share her reflections.
Thank you so very much. Good afternoon, good morning, good evening, everybody. Very glad to be here. I'm presenting the views of Africa at this event. Okay, so academic capacity, again, as has been mentioned severally here, is one of our major focuses as Africa, where we have diversity across the region. You have a Nigeria that has over 22 faculties of pharmacy, and we have some countries that do not have any faculty of pharmacy at all within the region. We have some countries that have their schools of pharmacy embedded completely within the College of Medicine or the School of Medicine, and you have others that the faculties are standing alone. So we have a diversity of pharmacies that are being produced across the continent. And so with the Pioneer Center of Excellence, and then with this initiative of setting up the Africa-wide schools of pharmacy, we think it's a great idea to help us unify across the region. We know that Africa has differences, several differences, starting from language, starting from including the way we teach, the way our cultures are addressed and all that. But with these schools of pharmacy, we are hoping we'll be able to bridge those gaps sufficiently for us to be able to train would I say, a basic minimum required in a pharmacy professional over, for the future. So through this, through the Africa-wide association, we're expecting that there will be collaborations in terms of teaching, in terms of sharing resources, in terms of collaborative research, in terms of supervision and sharing of expertise, such that any school that does not have any resource that they need to ensure that they train their faculty properly only has to reach to the association to get what they need for their school. You know, so that's one of the focus of the association. In terms of the various other development goals, we have just as Rajani has mentioned, in Southeast Asia, there are various levels of pharmacy practice across the region. We have drug hawkers that carry medicines that you would not believe, and people are buying across the region. We have registered pharmacy professionals, registered community pharmacists that sell these drugs and do not sell without prescription. We have those that sell with whether patient has a prescription or not. You know, so there's various levels.
I think Arinola.
To ensure that a minimum level is aspired to and is encouraged across the region. You know, so that's what we're hoping for the region. Thank you very much.
Thank you, Arinola, and thank you for all the speakers on this panel and for sharing that very insightful reflection for the region. And now to conclude this panel discussion, I'd like to come back to all of you with a very, very brief, because we're also going short on time, just a brief reflection on how what happens in your region, these developments are going to also contribute to the transformation at a global scale. And I'd like to pass on and start very briefly with Toyin again, please.
Thank you so much, Lillian. So some of the ways in which these developments were implemented in North America can contribute to transformation on a global scale. I believe that when academics are happy, so our focus was really on attracting individuals to academia, is when academics are happy and fulfilled in their roles, they're more likely to inspire and attract the younger generation to do great things. They'll be innovative in teaching, practice, and research. They'll do service. They'll go above and beyond. And so furthermore, the next generation is known, right, for their strength in sharing information and utilizing diverse communication platforms to disseminate joy, satisfaction, learning, and perceptions of the profession. And therefore, as these country-level tools that we plan to implement and frameworks, as we implement them widely, with the goal to attract the younger generation, I believe that the interest and joy will spread organically through the social networks, regions, countries, and ranks. This will also allow for more stories to be disseminated and present the opportunity to study why there is more interest in these academic roles. So we expect to see some publications or opinion papers and so on with regards to that. And this task force that is working on this in the American Association of Colleges of Pharmacy, I'm pretty impressed with the work they're doing so far. And as we learn more about some of those workload adjustment suggestions and how we can have academics be fulfilled in the roles, I expect other regions will gradually consider and hopefully adopt the successful frameworks and ways of working in academia. So we look forward to collaborating with our colleagues in the different regions on this platform to host academic exchanges and to elevate academic capacity worldwide. Thank you.
Thank you, Toyin. Silvana, anything to add on what has been said from your end?
Just a few thoughts. So I hope, and I think I'm excited to that this program will allow greater integration of Latin American pharmacists between us, because within the country we are not so organized or integrated, because we have a great diversity between us. So it's really important, these actions, to collaborate, to stimulate the collaboration and the harmonization between within the this region. So it's very important, and I hope we can be better prepared to share with other countries, so globally, and to collaborate doing the efforts for the health workforce development. I think we have some particular contributions, like the capacity to overcome the difficulties, overcome barriers that we need to do every day because of our big health problems and economic and social problems in our region. So we are used to find ways to overcome difficulties. So maybe something that will be helpful to share and collaborate with
Thank you, Silvana. Thank you, Silvana. And a brief insight from Paul as to the global impact.
Thanks, Lillian. I'm thinking what might be the global impact from the Western Pacific region. I think one of the strengths of the region is on patient safety. And that probably stems from the work in Australia on development of patient safety competencies. And so I hope one of the outcomes from the Western Pacific region that will contribute globally will be how we adapt patient safety competencies worldwide that will impact both practice and, of course, prepare and influence our programs to produce a patient-centric and patient-safe curriculum.
Thank you, Paul. Mohammed.
Yes, I think with this well-defined and structured framework for at the education and practice level will allow more collaboration within the region and globally between the regions. Also, we'll have a common vision of pharmacy and pharmaceutical sciences under the umbrella of organizations such as FIP or UNESCO. It will also provide a public perception of the role of pharmacists in healthcare provision. And also it will create a new career and job opportunities for the graduates. The outcome of this roadmap would be culturally competent graduates and pharmacists who are culturally and socially sensitive and aware of the quality, equity, and diversity concept. And they are ready to initiate partnership and collaboration with various pharmacists in the globe and with different backgrounds.
Thank you, Mohammed. On to Rajani.
Thank you. This initiative will certainly keep pharmacy workforce of this region and around the globe to continuously develop their skill, knowledge, and competencies. Partnerships and collaborations, which will undoubtedly be broadened with establishment of this Center of Excellence, will help academic institutions and pharmacy practice professionals in this region to share and learn from each other for delivering best possible pharmacy education and best possible patient care model, which can be exemplary for other regions to adapt a similar model. One of the tasks toward the development goal, as mentioned earlier, for this reason is developing harmonized curriculum that will be addressing the competencies needed that closes the gap between pharmacy practice and education. Competency-based pharmacy education will produce pharmacy workforce competitive enough to transform global health by empowering patients and other healthcare professionals through high-quality pharmaceutical care services. I believe that this may also help our pharmaceutical workforce to get better recognized by patients and the society for their impact and exert expert contribution in healthcare. They will also be valued across the globe, enhancing institutional academic capacity to deliver quality pharmaceutical sciences, education, and training for pharmacists and pharmaceutical scientists will definitely lead to research capacity enhancement that facilitates new discoveries, development in the field of health science. So this initiative of FIP will develop pharmacy workforce in our region and lead to professional advancement, not only in this region, but worldwide by enhancing academic capacity and competency level of the academic institutions. Thank you.
Thank you, Rajani, and the reflection from Arinola on the global impact.
Thank you very much. I think one of the things that we will bring to the table through this association would be the African voice in many of the research, many of the guidelines that are coming out. We in Africa, we have used quite a number of tools that are not really African based because we don't have the data, we don't have the skills, or we don't have the tools yet. You know, but by having this association and being able to work with the FIP Development Goals, I believe we'll be able to develop those collaborative practices that will be able to generate data, empirical data for various activities, various services, various practice initiatives within Africa that will be useful for global planning. It will also develop us as a people such that brain drain may be reduced to something that is more manageable than it is currently right now, because right now we have people living in droves such that the workload for those of us left is much more than when we were complaining a few years back, you know. So it's hopeful that when we know we can reach out to various people across the continent and across the world, it will encourage more of us to stay, to develop what we need to develop within Africa. That's one. I think those are the two things I want to add to what has been said already. Thank you.
So thank you, colleagues. It's been a pleasure to be on this panel and to hear that following the FIP-UNITWIN activities in our regions, by having this global vision led by FIP, the word that resonates is partnerships, as we learn from each other and share experiences. So now I'd like to move on. So thank you again for all your insights and your participation in this panel discussion today. It's been a very great pleasure and I'm humbled to be to have been with you, to have had this opportunity to lead this together with you. And now I'd like to pass on the floor to the next speaker, Alison Etukakpan, who from the FIP group, who will be sharing with you the very exciting part, which is the educational transformational toolkit.
Hello, everyone. Thank you, Lillian, for this kind introduction. My name is Alison Etukakpan. I'm the FIP Educational Partnership Specialist, and today I'm excited to launch the FIP Education Transformational Toolkit with you. Before I move on, I would like to acknowledge everyone who has contributed to developing this toolkit. And we have our CEO, Dr. Catherine Duggan, Professor Ralph, Neilhan, myself, and Precious, in addition to all of our FIP officers and volunteers, upon which there are different resources we have come together to develop this toolkit for you. And to give you some context and understanding about this FIP Education Transformation Toolkit, I would like to first of all let you know that in 2021, exactly 1 year last year, we launched the FIP Global Call to Action for Advancing Pharmaceutical Education. This was to advocate a needs-based approach to improving and advancing pharmaceutical practice and science across the globe. And this policy document was used is basically like a call for member organizations, for professional bodies, for academic institutions, and all pharmaceutical stakeholders to act upon 18 articles that will address practice and science issues in the context of education, all aligned with the FIP Development Goals. And exactly 1 year after that, today we are going to be presenting to you the FIP Education Transformation Toolkit. And this toolkit is a very unique resource. We really cannot do transformation without the right tools, without the right resources, without the exchanges. And the interesting thing about this toolkit today is that it's a collection of globally relevant FIP resources, and it's going to be used by professional organizations, by academic institutions, by schools, by individuals, by stakeholders, anyone that is interested in education advancement in your country, in your region. And this toolkit, which is a digital toolkit, I'll show you in the next slide soon, is literally making it possible for you to go to one point and you have access to all of FIP's resources that supports the different areas of development based on the FIP call to action for advancing pharmaceutical education. And here you can see the how to scan to access this toolkit. And I know my colleague Neilhan will also be sharing the link of the toolkit to you in the chat, so you can click it. And I welcome you to explore this tool to transform education in your region, in your country, in your context. In my next slide now, I'll be sharing with you how exactly this toolkit looks like and what you can do and how you can use it. So once you click the link or the code that was shown on the previous screen, you would come to this page on the website, and it basically shows an introduction to the toolkit, what it's about, the objective, and then we have straight to the resources to support transformation, all aligned with the 18 global call to action article. And when you click any of these, you have access to the FIP publications in that area, or it could be that you want to watch a video, a digital event that's happened in that context, and then you have access to any of them. And the interesting thing about this toolkit is that they are all mapped to all the 18 articles, and this is going to be a live document. What I mean by live document is that it's going to be updated regularly. So as new resources are coming in at FIP, we are going to be updating it and making it very useful for you. So now you don't have to stress yourself to think about where do I go to find a resource? What do I do? Once you click on the FIP Education Transformation Toolkit, it's all mapped to the element of education of the global call to action. And depending on the area that you have interest in, you'll be able to access the toolkit and get resources. So we invite you to use this toolkit and to also share it in your academic institutions, at events, and promote it. And as well, if, for example, you identify that there is a resource that should be in this toolkit, please feel free to share it with us at education@fip.org, and we'll review it and include it in the toolkit as we update regularly. Thank you so much for all you do. Thank you for your support to UNITWIN. I hope that this toolkit will be useful for you. And I'll hand over now back to Lillian.
Thank you, Alison, for presenting this very powerful tool that we are all looking forward to work with, and we also look forward to have your feedback into how this active and live document can develop. And now I'd like to introduce Nilan Uzman, the FIP lead for education and primary healthcare policies, to share some future perspectives.
Thank you, Lillian. Thank you, colleagues. We had really interesting panel discussions today and lots of engagement from the chat, questions. So we feel your excitement, we share your excitement. And of course, we feel responsible to explain you how we are going to deliver all that we promised together with our leaders today, and of course, with Allison's support. So just wanted to share some practical steps on where are we heading to with the UNITWIN program. So I have some announcements and some next steps to make things clear for you in terms of our plans. So let's go to the next slide. So as our leaders have explained, my colleague Allison has explained, we have a partnership with UNESCO, United Nations Education and Science Agency. And this partnership is helping us to facilitate the UNITWIN, University Twinning Program. And this program has established in 2010. And with all the roadmaps we have delivered, all the priority development goals we have identified, with a strong foundation of our next steps, we are now renewing our agreements with UNESCO. So we have just recently submitted our application, and hopefully we look forward to renewal of our agreements with UNESCO to restart our UNITWIN programs in the next year to come. So we are very excited for that, and we look forward to announcing this with you. Our UNESCO partnership is key to transformation of education and science, and eventually our practice. So we are really excited that this partnership will lead us to transformations as one FIP. And of course, specific next steps about the UNITWIN program. I've received a lot of questions from most of you, how you can get engaged, how you can be involved. So this is a University Twinning program. So our key stakeholders, of course, will be our universities. So we invite our universities, academics, educators. So the program will build on these key stakeholders. So we invite our FIP AIM members, academic institutional members, academic pharmacy section members individually to stay tuned. And if you are not an FIP member yet, we really invite you strongly, welcome you to our network, our FIP membership network, so that we can invite you to become a part of this network. Of course, the program is based on educators, academics, universities, but you cannot separate education from science and practice, as all of the leaders have mentioned in their messages. So we'll be welcoming our scientific colleagues, our officers across the organization, our professional organization, our regional forums, FIP regional forums, key regional stakeholders that are already in the region, such as European Association of Faculties of Pharmacy or Asian Association of Schools of Pharmacy. So these are our key regional stakeholders, so that the program will be delivered in collaboration with you. And of course, our regional chairs, our leaders are committed. So we are rising on their shoulders for this program. So we are great to see this level of commitment and excitement from our regional leaders. So stay tuned for next year, and we hope to see you on our network through our membership. And finally, in the next slide, just to give you some more specific information, we have been working with you through our workshops to identify your needs, your priorities, your FIP development goals, the resources you have. So we have, through a scientific methodology we developed, we have prioritized all of the regions, so that as our regional leader from Southeast Asia, Rejani Shaki, has mentioned, we'll start with the Southeast Asian region, but of course, we will be keeping the momentum and launching all the regional centers by the end of next year. And our, of course, pioneer region has been the African region, but then we'll start the new journey by building on the experience from the African region with the Southeast Asia, and we follow up with the next regions if this is sequenced. One click, please. So, as I mentioned, we'll be launching all the centers by 2024, so that we provide equitable support to all of the regions based on the resources available and based on the existing regional partnerships we have, to leave no region behind. So this is basically our mission and nature of our organization. So we'll be providing support to all regions in this following sequence. And in the next slide, I guess, we have also another announcement from me. we have shared many information with you. There are the roadmaps and the workshops we conducted. There are the call to actions. Our regional chairs, leaders all have the different perspectives. So what we have made is that we have developed the FIP-UNITWIN program. This is basically a capacity development program that we are going to launch in 2023. This program is for those who are going to become a part of the UNITWIN Center for Excellence for the regions. So once you're committed to become a member of the Center for Excellence, we enroll you to this course so that you build the capacity, you'll speak the same language, and that this whole information we've been sharing is offered to you in a brief and summarized way, so that as soon as you start and become a member of the Center for Excellence, you'll be speaking in the same language. So we look forward to launch this program in 2023 alongside our Center for Excellence in your region's program. So that has been my last slide. And I'll hand over to my chair. So thank you very much.
You're on mute, Ralph.
Yep, rule number 1 on Zoom is unmute. Thank you. A terrific summit, I think, and all the contributions by the panelists, and there's a lot to look forward to, a lot of sharing that can go on. But what we'd like to do right now is engage everybody in this discussion by going to the Menti, go to the link in the chat box. Is it there now? Yes, it is. Click on that and give us in one word your expectations and your view of what you have heard today from the FIP-UNITWIN program. So we'll give you a few minutes to put your words into that Mentimeter tool, and then we'll come back and look at the word cloud and see what you're thinking. Mm-hmm.
Ralph, I think we can start wrapping up.
I think we can now. I think great engagement by everybody putting in your words. And I think that I think the message is pretty clear. We got the smack dab in the center of the word cloud is the key word is collaboration. But I think equally is the successes that we've seen already and the successes we expect to have through this UNITWIN program, the engagement, making progress, and of course, the other one is the diversity across the various regions and how we will all be learning from each other. So I think that I'm the FIP Ed chair, but I'm going to try to be unbiased in my comments here. But I think we have achieved a level of success here, thanks to our panelists, thanks to everybody who is participating in this program and in their various regions to help advance pharmacy education, practice, and science. So I just thank all of you for your input, your ideas, and look forward to the work that you'll be able to do joining FIP and the UNITWIN program in your various regions. That's clearly going to have impact globally. So thank you very much, all of you, for joining us and being a part of this story up to this point. And I can't wait to see what the future brings us. It looks really exciting. Lillian.
Yes, I
Your
agree
thoughts?
with Ralph. I believe that in the last 2 years, this UNITWIN program has showcased the collaborative efforts that exist in our regional groups, and today this workshop has demonstrated great momentum, great interaction with our workshop participants, and it augurs very well for 2023 and the next UNITWIN projects and this school toolkit that we will all be sharing. Surely the response was the importance of having the diversity linked with the global activity that we all enjoy through this FIP vision. And this is what makes us go back to our regions and implement the transformation. So thank you for being together in this and for participating in this workshop, because in this way we are all contributing to our own initiatives in the regions and on a national basis within a global family. It's been a pleasure. Thank you.
Great. And I'll just add my thanks to everyone who joined us today, to our panelists for their excellent presentations and thoughts and ideas that they've had already and where they're heading in the future. And of course, thank Nilhan and Allison for their superb efforts in supporting the UNITWIN program, and both of them and their colleagues who put in all the hard work of developing that toolkit that I think is going to be a superb resource for all of us in pharmacy education around the world. So thanks very much, Nilhan and Allison.
And I'd like to also join in with these thanks, and also thank the FIP leadership, President Dominique Jourdan and CEO Catherine Duggan for the vision in getting this being implemented and actually get the ball rolling. So thank you.
Yep. Well said. And yes, thank you also from me, Catherine and Dominique. Your support has been essential for, I think, the progress we've made so far and that we're going to be doing in the future.
Yes, of course.
All looking good.
And just, if I may, 2 seconds, thank you to everybody who were involved in the project and in the development of the Center of Excellence. And for me, it's a central tool for FIP because, as I always say, educators, they have the most difficult job in the world because they have to anticipate what will be the pharmacy in 7 years or 8 years, and you are educating the future pharmacists. So that, of course, research is important, and but the most important tool for the public, for the population, is the quality and competences of the community hospital pharmacists who will be in the public tomorrow. And this is your work. And through excellent education, you can motivate young people to become a pharmacist. And I think through these tools, we can decrease the gap between the continent and having the development goals. It allows us to have one structure, one FIP, and one pharmacy all over the world. The goals are the same for everybody, but the schedule is different because of the different environment of the region. But we have to work all together, and it's my pleasure, and I am very proud when I see the results coming with this kind of webinar and project, so that I can only thanks everybody involved in the future of the pharmacy. Thank you very much.
So I think we've gone a few minutes over time. Thank everyone for sticking around with us, and just wish everyone a good evening, a good afternoon, good day. The sun's not up in my part of the world yet, so I have a long day coming up, but this is very invigorating, I have to say. So a really positive outlook on what the future holds for us. So thanks again, everyone.
Bye, everybody. Thank you very much.
Bye-bye.
Bye-bye.
Thank you. Bye-bye.
Bye.
Bye, everyone. Thank